so you know where to invest your money wisely when it comes to choosing a functional practitioner. Maybe that's me, maybe that's someone else, but I want to empower you with knowledge to understand what you're looking for. I've had a number of people in my Facebook group, the Fix Your Gut Collective, that's my free support group, and clients that I have worked with tell me that they have spent hundreds or even thousands of dollars on things like testing or protocols with a practitioner, and either they didn't use the results of those tests to inform their treatment plan, or they just didn't make progress with their treatment with this person. So I want to give you a heads up on what kind of things to look for. I do use GI map stool testing with my clients, but not all of them. So first of all, if someone requires that you do one of these expensive tests in order to work with them, that's a red flag right out the gate. That means they don't have enough clinical experience and knowledge to treat you based on what you're presenting with and based on your medical history. I am able to work with clients based on my experience and my knowledge and my research and expertise, and without even stool testing, basing solely on symptoms and medical history, I'm able to get many people, I'd say most people, to a point of completely optimizing their gut function where they don't have chronic daily symptoms without doing stool testing. So that means we can get them there with optimizing digestive function, balancing their gut bacteria, working on optimizing their diet, their absorption of these foods, looking at their stress levels and mindset and self-care, encouraging movement, optimizing sleep, helping to balance gut to balance your hormones. I do all of these things, and majority of the people I work with get better in about 3 months or so without needing stool testing. When I do use stool testing, it is on the people that have been working with practitioners or trying different protocols for years and years. They've gotten better, they've gotten worse. They've gotten better, they've gotten worse. And they're really struggling, and they want to know exactly what's going on with their gut. So I do the stool test to inform my treatment plan. So when I get those results back and I know exactly which microbes are in your gut, I also know markers of inflammation, absorption, immune function. That directly tells me which supplements, diet changes, and lifestyle changes are needed for you to move the needle on your health. And when I do that with people, we get them feeling better pretty quickly within a month or so. So again, if someone makes you do one of these tests before even starting to work together, that's a red flag. An experienced practitioner should be able to help you move forward with your health at least 70% or so better without having to do a stool test. Some people even get 100% better. The second thing is, if someone promises to cure your gut issues for good and that they will never come back, red flag. Your body is always changing. Life happens. Because we know the mind impacts the body, it doesn't matter how much work you do on your gut bacteria or how many enzymes you take or whatever work you do, that's great. But life is going to happen. You're going to get stressed out. Trauma happens, things happen, and it's going to impact your gut. So even me, I've been on my gut healing journey for years, and I'm a professional at what I do. I still get gut flare-ups now and again, but they're much less frequent than they have been before, and I know exactly what to do to get over it much faster. Okay, so if anyone promises you that, run the other way. The other thing is, I guess that's it for that. So yeah, the testing can be useful. The other thing I would say about testing would be don't put all your eggs in one basket. So don't assume that because you have a test that the practitioner is going to know what to do with that test. So I would always ask them before investing in the test, when we get my results, what will your plan be? Or how do you use these tests with your clients to inform your treatment plan? I'm happy to answer that question when people ask me, because it shows that they've done the research and they want to know and they deserve to know. So I will tell them, I look at the results, I look at the bacterial levels, and it tells me either, do we need to do some killing? So that's the first step in the 4R protocol. If you look that up, very common protocol used by functional practitioners. Do we need to focus on killing bacterial infections or overgrowth before we move on to repairing the gut and restoring balance to the microbiome? Or are you very low in healthy bacteria because you've done a lot of antibiotics, because you've been on a restrictive diet? If that's all showing very low and your immune function is low, which also shows up on the test, I then know we're going to skip that killing stage and move on to optimizing digestive function, repairing the gut, and rebuilding the balance to the microbiome. So bringing in more of the good stuff, okay? So if practitioner is not willing to walk you through exactly the steps that they will do when they get those results, that's another red flag. So all of this to say that, number one, doctors mean well. They are there to help you. They are necessary. But when it comes to functional gut issues like IBS, like indigestion, chronic heartburn, constipation, diarrhea, SIBO, they are not going to be able to offer you much help. And if you do use one of those medications, I guarantee you'll end up with someone like me because they have side effects and you're going to have to deal with those side effects. So again, they are there to diagnose and manage disease, not to prevent disease or to optimize the function of your body. And what I do with people is not just tinkering here and there, like medical doctors like to focus, like we said, on one system at a time. There's a gut specialist, there's an immune specialist, there's a mental health specialist, right? Together, we are taking a whole mind-body approach to healing and looking at those underlying root causes. And when we do it holistically, that's where the magic happens, because we know that your body and all systems are connected. Your body is truly an ecosystem and it needs to find balance. We can't just hit one system hard like the gut and expect everything else to balance out.